WCLN 1170 Radio and Star Vision Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Ladies and gentlemen, welcome back. The name of the show is We Should Know. Again, we're coming to you from Star Vision TV and Star Vision Cable, Channel 16, WCLN Radio. Want to thank you for all of those messages, comments you sent us from last week's show. The acting and actor and director and teacher of theater was with us, Lucy Lockamy, and we appreciate, Lucy, you coming in and taking time to talk to us. Got a wonderful show for you today. We have got Dr. Jonna Lagata with us. Dr. Jonna Lagata, you've been around for a while. You're familiar with this area. I'm going to just say a few things, factual things about you. You graduated from East Carolina in 3 years. The School of Science and Mathematics, graduated. Very prestigious background in psychiatry, medical doctor, kind of focus in adolescent behavior. Tell us a little bit more about you and how you came to this interest in medicine and psychiatry.
It was a really interesting road. You know, my dad's a psychiatrist, has been serving the state of North Carolina for coming up on 50 years. Did his work at Cherry Hospital initially as clinical director, went on to work as under James Martin's governorship at the state level, has served in the East trying to help with mental health reform and the changeovers from the local management entities. So I watched it growing up. Never thought I was going to do psychiatry. Started off we were looking at areas of surgery and pediatrics, loved it, loved working with children. And just down the road it came to be that my godfather actually asked me, he goes, "Have you thought about psychiatry?" And I was like, "No." And then we just decided, looked into it. And it really was just a calling. Mm-hmm. I've never been happier. I feel like the ability to serve that is wonderful. And I grew up in the East. I did go off to Arizona to finish part of my training out there, but the food's never as good as it is down here in the East, and I knew I was going to come home, and my family's here, and I couldn't imagine living anywhere else and serving the people here. So,
well, I'm sure a lot of our listeners would agree with you, especially on the food part. I don't know of anywhere that's any better than Eastern North Carolina. I noticed also in your background you did some work with NASA as well.
I did. I finished up at ECU in my undergraduate a year early and was recruited to help with the first mammalian pregnancy experiment that went into space. Wow. So through ECU Brody School of Medicine, which was granted the research abilities under Hubert Burton, who was with the Department of Anatomy and Physiology there back in those days, and went out to California, set up the pre-payload experiments. Actually followed it through up to the point of launch. When experiments actually went up in space and came back, and we learned a lot from it.
Well, and a lot of folks, would ask your name, Venkata Jonna Lagata. So right. When you say that, it gets kind of a stumbling through. So you've kind of taken on the name now of Dr. J, as Correct. It would be. So it kind of helps folks with that name a bit.
Absolutely. I'm, as I tell people, it's very comfortable. I don't mind what you call me as long as it's respectful.
There you go. Well, when we look at psychiatry, and I want to kind of start out, I guess, in a big picture moment here as we discuss the whole issue of psychiatry, because there's so many things tied to behavior and human behavior, and the dynamic is changing. You've been doing this now for some 15 years or longer, and then when you look at your family history, you could easily say a lifetime of experience in psychiatry, because your father is very well known and highly respected psychiatrist. So when we look at that over the past 15 years, what are some of the things that you've noticed has changed more radically in psychiatry than others?
I think the acceptance of mental health and mental health illnesses, psychiatric illnesses, as part of the medical care has been huge. Obviously, changes in reform are different, but what is lovely is there is a time period, and we still see it now, where there's a lot of discrimination and a lot of taboos culturally for people to say that I have a mental illness. And what I try to explain to people is, and what we're able to see in the research and what we're coming up with, these are true biological illnesses that suffer from the same components of deficiency: serotonin deficiencies, dopamine deficiencies, which are not that different from insulin deficiency and diabetes, thyroid deficiency and hypothyroid disorders, which are all linked back to mental illness disorders. Above and beyond what most people think is the top three illnesses: cancers, heart disease, and diabetes on the medical level, they're all superseded by mental health disorders. Those are the most common of the illnesses and the most debilitating. And so it's important to recognize that. As far as disabilities go across the nation, not just in North Carolina, the top 4 are mental illnesses, depression being the primary one. And these are treatable illnesses. What I love to throw out is what we often tout coming from ECU, because we were a research hospital, and of course that's where I did my fellowship and training. Mental illnesses, when treated, have a better recovery outcome than most heart diseases.
Wow.
But it requires, remember, the link is getting people in the door to recognize that this is a valid medical problem and that it can be treated and you can recover from it.
Well, let's talk about that bit from the sense of a character flaw. Do you think that the thought of the general population is improving as it relates to looking at mental illness as some character flaw versus a disease itself?
Oh yeah, I think that's an absolutely perfect articulation of it. We as a society are more knowledgeable. We are open to different things. The media is becoming much more open. People are able to talk and have dialogue about mental illness on television and in the media, and it not be a taboo discussion. Oftentimes, things are sensationalized, but when you look at the core, of any illness and you study it, you understand that, when you're able to relate it to somebody and say, this is the cause. The idea in the past was we didn't know where mental illnesses came from. The very earliest ideas were, the concept that people were possessed. It was a spiritual flaw. And of course now we know that that's not the case at all. These are actual deficiencies of chemicals, neurochemicals in the body. And when you can explain it on that level and people have a why is this happening to me, then they're able to accept it, find a solution for it, find resources to help them and move forward.
I think one of the telltale signs too, when you look at the number of psychotropic drugs that's being administered by doctors, medical doctors like yourself, and psychiatrists like yourself as well. A lot of these drugs are to help normalize that patient, and they've increased in their prescriptions over the past 10, 15 years radically.
Absolutely. Again, knowledge is growing. There's a lot more options out there to treat mental illnesses. We didn't have a lot of options back in the day. You could name top 3 medicines that people try to use for everything. Lithium being one of them. It's one of the oldest and the most, and people look at that like it's strange. It's still used today because we know the most about it. It is safe when used appropriately. And it's appropriate. Medicine in terms of medical and psychiatric are now blended. People are recognizing that the top 4 diseases across society that cause disability are mental health illnesses. They're recognizing that in any medical home being the doctor's office, the top 10 medicines, the top 8 of the 10 medicines prescribed out of a doctor's office are psychiatric medications. They're the ones that cost the most for the state. So these are important information. So knowledge is power. Part of what I do, like meeting with you today, is also talk to providers in our community, different doctors, nurse practitioners, family nurse practitioners, and PAs. All of these people are important to the care of our patient. All the therapists and the counselors are important. But knowledge is power. Recognizing that these medicines are helpful, they're not the whole solution, is important to get the education out there so that the people treating people are able to do so correctly. And I think people are open to that now. They recognize once you assist a medical illness, the ability to recover from a diabetic break, the ability to recover from cancers, the ability to recover from a heart attack goes up. The literature is out there, the research is available, and it's still ongoing, and I think it's wonderful.
Having a background both as a medical doctor and a psychiatrist, has there been a change in the education of medical doctors to add behavioral health issues into the curriculums in medical schools now?
Absolutely. Of course, we always would want to wish for more. You want more information out there. You want more time to educate. Where we've taken some steps back in doing that, we've taken other steps forward. Psychiatric medicine is a huge component that needs to be integrated into the care of patients, but also the education of the people caring for those patients. I do a lot of teaching at ECU. I've just been attained as teaching faculty for the Department of Pediatrics at ECU. And part of that goal is going to be going in and working with those young doctors before they go out into the communities, the residents, the medical students, and giving them very basic, what we like to call mental health training, education on what are the basics. You want to teach people how to recognize risk. Because again, suicide is still a #1 cause of death for people between the ages of 18 and 24. You want to educate how to identify risk. What do you do once you've identified it? It's not enough to say, oh, this person is at risk, but teaching people how to say, now what do you do to help them? Not just for physicians, but for the nurses and all of the people that help care for me. As I like to say, it's a team effort. No one person is doing this job alone. So suicide risk and teaching people about risk, not only recognizing, but how do you help them. Recognizing depression. It is still one of the major components. And depression looks different at every age and stage. I am a child, adolescent, and adult psychiatrist. My youngest patient is 3. My oldest is 84. And the love that in that range, you know, your life changes look so different at each point. How a person in their childhood who's experienced a trauma, you know, experiences depression is so vastly different from someone in college and different from someone in a, you know, in their work life who has a family, and then someone in their ages of retirement. So being able to recognize that in all aspects of primary care, so that people working with each of these age groups can recognize, how do I distinguish what mental illness is? What do I need to ask about? You know, when they come in and they're here for a stomach ache, or they're here for, you know, a recurrence of a headache, or they're just lost a spouse, but they're healthy, I need to be focused on, you know, what are their emotional needs? And helping them learn that path is really fun and exciting. And it's wonderful that it's being embraced. You know, we like to call it the integrated care plan, integrating both medical, mental health, and social. So it's not just about, we love the wraparound idea of, we look at the person physically and how their physical health is doing, their mental health needs, but also, are they socially connected or isolated? As we move forward in a progressive world, these are things that we have to address.
We're going to take our first break. Ladies and gentlemen, we want to thank you for listening today. We're talking with Venkata Janagalada. She is the doctor here on psychiatry for Eastern North Carolina, East Point Mental Health, 12 counties. We'll be back in a moment. Ladies and gentlemen, welcome back. The name of the show is We Should Know. I want to thank all those folks out there that mention us on other shows. One of those is the Boogie Shoes Radio Show with Robert Stroud. We enjoy Robert mentioning us, and I enjoy going down periodically on Saturdays and having a conversation with Robert and all the thousands of folks that listen to his show. Don Smith, Wayne Weeks, the morning show with the guys down in the morning at the radio station periodically mention their show. And we certainly appreciate Don, because prior to this show airing on radio, Don mentions who our guest is and a little bit about it. Today, we've got an excellent person with us, and I'm going to try this one more time, and that's Dr. Venkata Janagalada.
Perfect.
I think the more I say that, the more I like the sound of it. It kind of rolls off of my tongue. But we're fortunate to have you here. And as we talked about earlier, you know, your background as a medical doctor and psychiatrist, and some of the kinds of things that we look at, we have seen over time a lot of myths about people with behavioral issues. And some of those myths, we can look back, even I'm sure folks and some of our listeners will think back in high school, especially if they're at my age, and they think about some of the ways folks were treated back then that had behavioral issues. So let's talk about some of the myths and some of the things that you face and see each day as in your profession.
And thank you for the opportunity. This is a fantastic forum to do this. I'm just going to cover some of the basic things that we always talked about. One of them that really is wonderful is that we don't think that people are crazy. That's not a concept or a word we use. Obviously, it's used in jokes and in dialogue, but mental illness is a type of medical illness. It's biologically driven. It comes from our genetics, from who our mama and daddy and our grandparents and so forth and are. It comes from what happens to us socially. We see that in our incarcerated population. We see that in our veterans. Who served us so honorably. We see that in our young people, you know, who are in difficult and struggling systems in their life. So the idea that people are crazy and that it's just something that they are doesn't exist. These are biologically based, psychologically based illnesses. Number two, people often worry about seeking help because they think that two things are going to happen. One, that they're going to be on medicine for the rest of their life. Not true. If you go through a plan of care, except for people with really severe chronic illness, which is a rare number, we're talking 1 to 3% of mental illnesses, most individuals with good medical, psychiatric treatment, good therapeutic treatment can be medicine-free for years or forever after the initial treatment, depending on the case. So the idea that people are on medicine for the rest of their life doesn't exist. The idea that if you tell somebody that you're having problems, that you're going to end up in a hospital or some room that's padded with white walls, also not true. The hope and the gain of being a psychiatric physician and practicing this special type of medicine is we want to keep people out of the hospitals. We want to help them be able to be functional and responsible in their own care and be part of the team that helps them care for themselves. It should be no different than treating long-term diabetes or heart disease. And lastly, I think it's really interesting. People think that all illnesses are separate. You know, if you have diabetes, that's separate from your illnesses with your heart. There's illnesses separate with cancer. And then, you know, mental illnesses are separate of themselves. The whole situation is what we call multifactorial, which means they're all integrated. You know, the way you feel emotionally affects your physical health. You hear wonderful stories all the time about young people that have beat cancer and have lived long, fruitful lives because of their emotional health and the support they receive. The idea that we don't need anyone socially is another myth. No one does this alone. I tell my patients and my parents of my patients every day, we're a team. We're going to be successful together. You can't do this by yourself. I can't do this alone. And I don't expect anyone to do this alone. Everything requires a team effort. And that's important to remember. You never have to try and think that you have to do this or struggle alone in your illness. People can help you. People will join with you.
One of the things I think is interesting, as I look at your background and in our conversation, you've got experience as a psychiatrist, a practicing psychiatrist in Pitt County and in Greenville. You decided to make the decision to be the medical person for East Point, and I kind of choose I'm not big on titles, but anyway, you're the person, the go-to person as it relates to psychiatry and medical issues for 12 counties now for East Point. That's a huge step for you and a huge step in responsibility. What caused you to think, well, this is something I may want to do and something I would accept doing, because it's obviously a lot of work, and I know just this past weekend you spent and working in the environment and being on call and those kinds of things. What drives you to reach that? Where is your passion point for that?
My passion comes in 3 areas. One comes from my family. My family has always been a family of service. Obviously, my dad did this work, and one of the things he always taught me about when I asked him when I was young about psychiatry is, Dad, what does a psychiatrist do? And he told me, psychiatrists treat people's pain, but it's not the kind of pain that anyone can see. And when someone is hurting that bad and they come to you, you need to try and help them. So understanding that it was something that not always can you see and take an x-ray or visually see the kind of health problem someone has, but that it has to come from having the compassion to understand that it goes deeper and asking those questions. On a level with East Point, the wonderful thing was what a wonderful reputation as an organization. 12 counties. This is my home. I grew up in Wayne County. We went to school at ECU. And I couldn't imagine spending my life getting married and growing old anywhere else. It's about pride, not just in who I am and what I do, but the community I come from. We have good people here. We have hardworking people here of every stage and caliber, and everyone deserves a chance to get the resources they need and the help they need. And the idea that I get to champion that is so wonderful. I come from a split family, physicians on Dad's side and farmers on my mom's side, and you can't imagine anything better to grow up in, knowing that you understand the concept that both of these cultures wake early before the sun gets up. They work hard all day long. It's late and the sun's already gone down before they go to bed. And at the end of the day, feeling like you've accomplished something for more than yourself.
Well, and I think East Point's fortunate to have you as well.
Thank you.
When we talk about issues, I want to kind of get down to some of the nuts and bolts here. One of the big issues, and in fact, in preparing for this program, I had a number of folks to email or question and say, well, ask her this. And they want to know about bullying. They want to know about issues in school with children. And one of the things I think is, as I'll kind of couch this question, is that over the past few years, and most recently Sandy Hook, in which we had huge tragedies, I mean just horrific kinds of things happening, the question, the battle was between guns or behavioral issues. Which do we address? And it is as though different groups would take one approach and other groups would take another approach. I don't think there's any question that there was behavioral issues involved in just about all of these that I have looked at. There was a behavioral issue, some more severe and prevalent than others. Where are we on recognizing behavioral issues and how critically important they are, especially in the school setting and in public schools?
I love this question. With my work with the state, one of the things that I've had the privilege of doing and being a child psychiatrist is looking at our school nurses. Have a wonderful organization. They account for this. Our school psychologists, which are few and far between each school system, are available. The issues that you're raising are interesting because it talks to several points. Number one, our families need to be aware. One of the caveats that I always tell people when they walk in my office, if my family's not healthy, the child is not going to be healthy. So recognizing markers, understanding if there's a need in the family, understanding how it affects your child. So coming from the home. Now in the school setting, teachers are becoming more educated. Our school systems are becoming more educated to recognize needs of our children and hopefully making those referrals to a counselor or just reaching out to the parents and saying, hey, it seems like little Johnny is struggling. What can I do to help? Are there things that are going on that we need to address that I can help comfort him in the school setting? And we're seeing so much of that. And I really have to applaud our public school system and the teachers that are working with our kids in that system. So that's a component. Now let's look at it on a different plane. On another level, what are the primary issues in schools? We do see a lot of bullying. There are federal mandates, there are state mandates that ask school systems to try and educate that bullying is not acceptable behavior in the school, but you still see it. I really encourage teachers to identify it and bring it to attention. I encourage parents that when they notice that their child is becoming withdrawn, ask them. Sometimes kids are worried and they won't tell you because they're afraid that the parents will go to school and make a big fuss about it. And it's important to say, I can go in and try and work on this on a bigger plane and say, maybe we need to do some school education, have a school forum, an assembly. The other three issues that I think are really plaguing schools right now is identifying kids that are in need because they are falling through the cracks and joining gangs. Gang violence and gang behavior is starting earlier and earlier, and recognizing that kids are looking for acceptance in some setting because they can't find it in their homes or their communities. And that's just a rallying point. I know that our law enforcement agencies through the state of North Carolina are doing wonderful work to try and build better alliances for gang prevention, and they're recognizing that it starts with a younger population. Additionally to that, I think we'd be really remiss if we didn't touch on it's a younger and younger age where children are being exposed to violent behaviors, much more sexually aggressive behaviors, not just in school settings, but in media. And I'm not saying things are bad that are happening in school, but there's exposure, from things that they're able to pick up on the internet, from dialogue, from what they're seeing and hearing in the public setting. Drugs and alcohol are an equal part of that. Where we used to talk about the education and the awareness of parents that at this age 12, we are saying now kids need to be monitored and maybe start the dialogue at age 8. It's starting that early that we need to have these conversations because their exposures to things as basic as marijuana are being much more exposed earlier. 70% of children throughout the state of North Carolina who were asked if they had ever seen anyone in their peer group said yes to the fact that they were exposed to marijuana. 70%. Didn't acknowledge that they had used it themselves, but that had seen it in action. Age group was from age 8 to 12.
Well, I think these questions are relevant and important. We're going to take another break, and we'll be back in a moment. Ladies and gentlemen, we're talking with Jonna Lagata, the doctor, psychiatrist, medical doctor. We'll be back in a moment to continue this discussion about bullying and various other aspects affecting your mental health issues. Ladies and gentlemen, welcome back. We're talking with Dr. Venkata Janagalata. She is the medical director for East Point, background in medicine, psychiatry, Pitt County, Wayne County, grew up in this area, Eastern North Carolina person. Probably a lot of folks know you from your practice. A lot of folks probably know you from just seeing you around Goldsboro. A lot of folks probably know you from your father, which is a highly recognized psychiatrist here in North Carolina. We've been talking about, on the previous segment, the whole issue as it relates to bullying in children in schools and these horrible tragedies that we seem to face all too often in the United States. I want to kind of transcend that and talk a little bit about the whole process itself and where you see we need to go as it relates to schools. The legislature just put a huge chunk of money in the budget for public schools to deal with safety issues, and there's this process that has gone about now with local law enforcement agencies in schools and superintendent's offices doing security analysis of schools and putting locks up and making sure the doors are secure and the windows are bulletproof and all this kind of thing. What are we missing in that equation when we look at human behavior and the psychological side? What do we need to be doing specifically, and especially in Eastern North Carolina, because a lot of our schools, in fact, the majority of them are rural locations and rural sites, and what do we need to be thinking about? And I think you touched on a couple of those as it relates to the family, what the family needs to look at, and all of these cases, everyone that I've read that's happened since Columbine, the big thing was afterwards, news media would put a camera in somebody's face and they would say, well, I knew something, there was something unusual about this person, or this person, there was something wrong about their behavior. So how do we deal with that?
And I love that you're bringing this up. I think I'm very supportive of trying to be protective and giving our kids a protective and safe environment, but at the same time we need to identify the kids that have needs. And the adults that have needs. I don't want the restriction to be that the children are alone. The teachers that are there, the groundskeepers, everyone else in our systems in the schools, we need to do a check-in. I had this conversation at East Point when I joined and said, we're only as healthy as each individual is healthy. So if somebody is struggling or having problems, approach them, ask them if there's something you could do to help. It's amazing how many times that can make a big difference. If you notice that a child is having some difficulty, maybe a little different and is much more isolated from the other children, and even the kids say, that kid's a little weird, that might be a child that requires or would be really supported by someone, taking some time with them, identifying what their needs are. Maybe they just need someone to talk to because they are isolated, because they don't fit in. And the same thing with our teachers and our families, recognizing, our teachers are wonderful. They work so hard in our public school systems here. Their dedication to our children should always be honored. But they are run short too, and making sure that we recognize what their needs are. We're only as healthy as each individual who is cared for, and the stigma needs to go away. The idea that someone presents something and says, I'm just checking on you because I want to make sure you're okay, shouldn't be taboo to say, do you have an emotional need? I would love to see a world where somebody can go up and say, hey, it sounds like you're really struggling. I noticed that you're eating a salad today because your heart is, you're trying to get your heart healthier. Yeah. Saying the same thing, I want you to be healthier and more emotionally. It looks like you've been really down and sad for the last couple of weeks. Is there anything I can do to help? Do you need more time? Would it help to have some time and maybe just have lunch together? Making sure that mental health is as important as physical health in the way we approach each other, and not make it taboo or something that will be an embarrassment to talk about.
I think one of the things I hear you saying, and to kind of simplify it for me as well, it appears that periodically, no matter how rough things are or how tough somebody appears to be, everybody periodically needs a hug.
Absolutely.
So it
couldn't say it better.
Kind of breaks it down where all of us can understand it. So as we look at that and we look at the whole spectrum of emotional disorders, and we back away kind of in a camera view from the schools and we look at the larger dynamic, in Eastern North Carolina particularly, with the military bases here and a lot of issues and a lot of returning military personnel, we hear the term PTSD. Post-traumatic stress. We hear various other things. We see media quite often where there's been a psychotic break, and I'm using terms that only you can explain, but when we look at those things, how vulnerable are we as a society to a lot of these things that is occurring that deals with emotional and psychiatric cases?
We're all vulnerable. You and I are vulnerable. You know, we're made in a certain way that our bodies handle stress to a limit. And when we hit that level of stress, we break. It's no different than running a marathon. You have to stop at the end of the marathon or you're going to fall down. And your body can only handle so much stress. What we like to do, and as a child psychiatrist we always joke about, we're more about prevention. When you recognize that you're getting ready to go into a stressful situation, preparing yourself in advance. I love what our local military bases are doing now. They're recognizing this in the VA system, which my dad serves now. They're recognizing this in their own clinics of the active duty military and our National Guard, which I think have always been underserved and are also being recognized to get care now, as well as in the community at large. Organizations, companies are looking at individual happiness of health because prevention is the key. This is how I teach it in the clinic when I'm working. Stress is both positive and negative, but stressful events happen every day. A wedding is a stressful event, but it's a joyful event. But it causes your body to take on more tension. It makes you become more focused on something, and your mind is constantly occupied. So you forget to do the very basic things that you need to do. Take time out, hug somebody, eat appropriately, get good sleep. I just wrote an article for the Daily Reflector out in Pitt County, which talks about, you know, your mood is set on the way you feed your body and you care for your body. If you haven't taken good care and gotten good sleep and you're not eating well, you're not going to be good. And teaching that level of prevention on every level in all businesses and in our community is what's really going to make the difference. And being able to reach out and say, hey, can you talk with me? I need somebody to listen for a little while. It won't fix the problem, but it'll make you feel less burdened by it. We call it verbal release. When you verbally are able to just talk out something that's bothering you, you feel better after it. You know, we have the old spiritual idea of confession gives you that. You are unburdened by it. Sharing with each other. Getting that, you know, I hear what you're saying. I feel for you. I'm here beside you to support you.
September is National Addiction Recovery Month, or Recovery Month, and it's been going on for some time now. It highlights the number of people in our society, in the United States, that have behavioral issues, that have addiction issues, and those numbers are quite large. I mean, in the millions, seeking treatment. When we look at that, we're kind of set aback at that huge number. But in reality, as best I can extrapolate from some of the readings, that's only a small portion of what really is out there that hadn't been identified. Speak to that and what Recovery Month means and how important it is to your role at East Point.
Well, we have a wonderful set of staff that work specifically on not just prevention, but substance abuse assistance at East Point. Please feel comfortable. People can go to the website. It's got a long list of things not only that you can do to prevent, but agencies that can help you, as well as individual contacts of how we can make that happen. Along with that, I think it's important to identify that addiction, the need to drink alcohol or use a substance to cope with what you're dealing with in terms of a stressful life, but coping with it in an appropriate way that affects your health and impairs your ability to do your job or to be with your family, that is an illness. Addiction is a true illness. It's not because somebody is wrong and they can't control it. It's not because somebody is having any problems that they just haven't gotten their act together. It really is an illness. And I think that's important to say. Being an illness, it means that you can get treatment for it, you can recover from it. And that is the message of Recovery Month. You know, substance abuse is a legitimate illness. We have resources here to help you. Let us help you find those resources. Let us help your family understand what your illness is. Because, again, your supports are what make you able to succeed in life. No one gets to where they are without being supported and helped along the way. And educating our communities, our families, and then helping those individuals. And it's not just about alcohol and illicit drug use. We're talking about, you know, meth is in our communities. Heroin is making a huge comeback in our communities. There's also a large population that is using prescription painkillers, narcotics inappropriately, selling them on the market. You know, we have the substance abuse regulation through the Department of Drug Enforcement, who helps us try and keep control of this. So things are moving in better directions every day, but the idea is that we need to help these individuals. However they ended up in that trap, of being in that cycle of addiction and illness, everyone deserves a chance to heal and get better. And it's possible.
And I think the whole process of this being a national campaign of awareness is important too. And I know East Point puts a lot of effort on making sure folks are aware. There's proclamations that goes out to all the county leaders, and they read that proclamation, which basically affirms what you just explained. Those kinds of things are critically important, but we continue to see this issue of addiction being categorized as a character flaw, and it's recognized scientifically as a chronic brain disease. Affecting one kind of portion of the brain that's interesting is that portion called the hippocampus, which I'm told is about the size of your little finger maybe. But it produces dopamine and causes folks to literally, come back and need more and more and more.
The hippocampus is a great. It's literally a curved. It's a curved like a peanut. It's where your brain has a memory of fondness. So when something felt like it was okay, that part of your brain remembered it. It's a memory component. So when someone is in pain, be it emotional pain, they've been through a trauma, and they said, you know what, I just need to relax, I'm going to have a drink. We'll use that as the most basic example. The hippocampus remembers that, and it says, well, you know what, I remember that I drank, and I felt better after that. At the same time, the rest of the brain is getting a used to that and learning the pattern of addiction. So that's how addiction starts.
We're going to take another break. Dr. Janna Lagata is with us today, and having said that name a number of times, I'm hoping I'm getting close to getting it right. So stay with us. We'll be back in a moment to continue the discussion. Ladies and gentlemen, welcome back. It's the last segment of the show today. We want to thank you again for being with us. Tuesdays, 2:30 to 3:30, 7 p.m., Tuesday, Wednesday, Thursday on Star Vision TV and Star TV. I hope you're enjoying the show as we are. Dr. Janna Lagata is with us today, and I've had an opportunity to say that name several times, and I think I'm getting a little bit better with it. I'm not sure, but often referred to as Dr. J. We've talked about your background as a medical doctor, as a psychiatrist, family history of being in a family that grew up. Your father was as a renowned, well-known psychiatrist. We have worked on several subjects that really are subjects that society is just getting, and that's the bullying issue. That's the issue with guns versus emotional psychiatric breaks and all those kinds of things. We've touched on that. Talking as we went on break a while ago, we talked about addiction. And for some reason, a quote comes to my mind, and it's a quote by Oliver Wendell Holmes that says, "Life is a great bundle of little things." And when I look at that quote and think about that quote, I think about the brain and the mechanics of the brain and the neurons and all those things that occur in the brain and the functionality of that. And I think it's important at some point in time that we do spend a little more time talking about that portion of the brain that we were talking about as we went off the air for our last break, and that hippocampus and what it does. Because for us to understand what's going on, I think it's important to understand that dopamine production, and that a lot of people refer to it as their happy place, is somewhere around that hippocampus. So let's talk a little bit more about that.
Okay. Excuse me for
Go right ahead. Go right ahead.
I'm losing my voice for
Have
a
some
second.
water. Take your time.
The biology of mental illness is really interesting. We have some very specific neurotransmitters: dopamine, serotonin, and norepinephrine. They are our happy hormones, our happy neurotransmitters. If we're deficient in them, they cause problems. If we overexcite them, like dopamine, when it's in a situation of addiction, then we have problems. And that's where illnesses are affected. That's why it's important to recognize that mental illness is a biological illness. We can help treat addiction by balancing dopamine, getting it back into normal range. We can balance depression by improving serotonin uptake. And those are just two examples. But the brain is a very complicated garden. How you care for it, how you treat it, the chemicals you put into it, the food you nurture your body with, all affect that. And so being able to identify what is impairing it, the use of alcohol, the use of illicit drugs, recognizing that kids that get breakfast in the morning do better on exams. recognizing that when you're depressed, my first question to a patient that walks in my office is, how has your sleep been? Has your brain had a chance to recharge? How has your diet been? Did you eat today? Very important questions, not only for our kids, people who work, I mean, we work such heavy schedules in our jobs now. A lot of times people don't take time for lunch. Our elderly, because of their fixed income, will often only have one meal a day, and sometimes it's as little as a can of soup. In our 12 counties in the East Point family, we look at our families on those levels and try to figure out not just what about their mental illness can we help, but what about their entire lifestyle can we help be a resource to and help support.
When we look at these things and we think about some of the issues that we've been talking about today and the dynamic of each and every matter that affects our society, these are crucial issues that it seems that quite often we kind of overlook. I mean, you just mentioned the intake of food. You mentioned that being part of our stability and maintenance of life. And there's a group of people that fit in that area of younger adolescents and the older population that I read somewhere where that was where most of our major psychiatric concerns were.
Absolutely.
And speak to that a bit, especially as we're looking at a growing population of older folks as the baby boomers continue to swell that group of older people. We're looking at Alzheimer's and various other mental issues that are affecting those older folks.
That's a great question. Thank you. Again, if you take care of the very small basics, that's the 70%. Medications do about 30% in helping treat illnesses. But as I tell people when they come in my office, you know, if you had heart disease and you ate it across the street at a fast food restaurant and had a burger every single day, but didn't eat any vegetables and have any other nutrition, of course your heart's going to struggle. In mental health, if you don't nourish your body, if you don't get at least 6 hours of sleep, if you don't do these very basic things for your body's going to not be able to handle the stress, as we talked about in the prior segment, as well as it could have. Prevention is key. In the elderly, we're looking at situations, again, fixed income, less resources, inability to get out of the house, few people, social isolation because they can't get out and get to church or get to the community or get to their pharmacy. In the young population, again, it costs money, you know, meals are expensive, fixing breakfast, you know, getting a good lunch, school lunches, kids still skip their school lunch, you know, and then dinner at night, depending on the economy of the family in the home. And a lot of times, it's not just about the economy. Are the families sitting down to eat together again? Or are we doing something quick because, you know, everybody has soccer practice, ballet, I'm going to be working late at the office today. You'll just have to grab what's in the fridge. So protecting the basic essences of that. And then just taking time. You mentioned this, and I'm so glad you did. It's always important to take a break in the day. Appreciate yourself, appreciate your family, appreciate your coworkers, and enjoy. Say, we're really lucky to be here. We're really lucky to enjoy every day that we have.
We're really talking about a kind of a social, psychological change of think here in what we do and how demanding we are on each other and on our employees and on how we react. And it causes me to ask the obvious question, and I think anybody in Eastern North Carolina can recognize this, because there was a period of time that there was a crop in Eastern North Carolina called tobacco, and it made cigarettes, and cigarettes was a huge, huge product here. But now all of a sudden we've seen over the past, and it's really a short period of time, just the past decade, cigarettes and cigarette smoking, as it relates to the carcinogen of nicotine, it relates to nicotine being a problematic addictive substance. We've done a huge, a progressive effort in eliminating a large portion of smokers through aggressive advertisements, understanding, and education. Why can't we do that with addictive substances and some of these other things? Is the funding just not there? Or what?
I think it has to happen, and I'm glad you said that. And I think it takes organizations like this, having the community say we want to support this, we want our communities to rally behind, educating our children, educating our communities, working with law enforcement, which is also difficult because sometimes individuals are worried about saying, I think that there's an element in our community that is supplying drugs to our children, is creating meth in our communities, is a pathway. The I-95 corridor, we used to call it, is a pathway for the distribution of drugs to our children, to our families, to our vulnerable veterans, and our reformed and post-incarcerated individuals who want to be supported, to want to not fall into those traps, because they need good mental health care. And again, having the conversation, Recovery Month is just one step of saying, hey, we have resources here at East Point. We have resources all over, not just North Carolina, but nationally. Let's make this a bigger voice for everyone.
And I think you're exactly right. When we look at some of the pathways of folks, selling drugs, bringing drugs into North Carolina, we got to give a big salute to our law enforcement people for being out there on the front line, for taking that risk, because some of these situations are extremely dangerous. We have a meth task force here that's in play that is basically following some philosophies with Dr. Mary Holly, who started Mothers Against Methamphetamine, and we talked about her a bit on break a while ago. She's been here and done a couple of sessions for us in the region. Those are the kinds of things I think we've got to do as education and education value. But the critical part to me is folks like you that step out as scientists, as medical doctors, as psychiatrists, to say there is a linkage here. There's something we can do about it. Is that part of something that you see yourself doing more, involved in the communities throughout the 12 counties?
Absolutely. One of our goals is for myself and our team, it's never just me as an individual. I will always look at the work we do as a team. I plan to go to each of the 12 counties, and we're happy to expand it beyond that. Pitt County, where I practice, is not in my 12 counties of service for East Point, but in my education there, I'm happy to go anywhere we need to go, and I specifically plan on going to each of the 12 counties, meeting with our communities, but also meeting with our doctors, providers, counselors, saying, hey, we're a resource. Let us help you. Let us educate you. Let us help you figure out what needs to happen, because we have wonderful agencies in each of our counties. They're there to serve. They're there to provide the addiction support to families and the mental health support to our families.
Well, I want to give you, we're kind of getting down to the point of wrap up for the show, and I want to give you a minute or so here to wrap up from whatever you want to tell folks from your position as a medical doctor, your position as a psychiatrist, your position with East Point, in the director role with East Point. Whatever you want to say that maybe we've missed.
I think it's important to point out that there's a couple of things that are really important in our communities. We are a wonderful community here in Eastern North Carolina. I love and I'm proud of being here, having grown up here. East Point is a great part of that program to move us forward and to improve mental health. Remember, 2/3 of people across the nation have mental illnesses, are having functional, positive lives every day. And it's not coming from just their abilities to get help, but us as a community to rally around each other. I really want to support not just the individuals in our communities, but recognize our special populations, our young people in foster care, our veterans, our reformed and post-incarcerated folks coming out of the Department of Justice institutions, and also our elderly. I think that, as you said, as our population gets older, we're going to grow together, and let's serve each other. And remember, this is Recovery Month. I really reinforce that welcome you to join us on the East Point website, call our 1-800 number, and get some assistance.
Again, thank you for being with us today. Ladies and gentlemen, we've been talking about psychological, behavioral issues, and we've been talking with Venkata Janalagada, who is the director here, medical director for East Point. We look forward next week and hope that you will be back with us. We look forward to seeing you on the radio.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question or comment regarding this or any episode, please send your email questions and or comments to jwsimmonsedu@gmail.com. And remember to tune in every Tuesday afternoon beginning at 2:30 for another informative episode of We Should Know.